So, hello and welcome to this class. As you know that we have been dealing with quite a few topics here in the healthcare analytics. One of the most important thing that yesterday or in the previous class we talked about the sources of data. There are two sources of data we said, internal, external, right? Now that we come to the third module, and this module is important because this is a more practical. If you look at it, there are four modules. Out of these four modules, two modules are, one is the introduction, the other one is the trends, which we will be taking up in the last class, maybe on Saturday. And the second and the third module, we are in the third module. The second module was about sources of data. Now, the third module is about data mining in healthcare. How do we really get the data? How do we clean up the data? Where do we get it? You may generate tons of data, right? Data can be unstructured, data can be structured, and so on. So, data mining, they will be able to look at the meaning, its process, sensor data, and the informatics data. Okay, and then we will also be able to look at the non-clinical data applications. And then the last part in our agenda today, we'll try and finish this, is the healthcare cost prediction or predictions. So these are the four items that you will be able to have it. So let's go one after the other. Data mining, right? So data mining, meaning and process. How do we get the data and its meaning and as well as the process? So if you look at what is data mining is nothing but it's a process of finding previously unknown patterns and trends in databases. What we never knew about it, we will be able to know now. That's the idea. So it's a process of finding previously unknown. Previously unknown, there are lots of patterns. How many patients are coming and you missed out something or you don't know about the pattern. So that information, so using that information to build the predictive models. So it's a fascinating thing and it's also going to help. So alternatively, it can also be defined as the process of data selection and exploration. So you are taking the cues from the previous data, which was not really known pattern, and you're going to select and explore. Why are you doing it? You're doing it because you want to build the models. So the models, like using the vast models you may have, right? So what do you mean by models is an important part. Okay, so there we go, right? So these models will be able to have the data stores, and that's really really good. Just a minute, somebody is trying to call me. Hello, who's this? Hello, who's this? Hello? Yes, please. Hi. Yes, am I audible to you? Hello? Hello? Yeah, please go ahead. Okay, sorry. So there was some disturbance. This I thought some student may be calling how to join the class, but looks like this is a marketing call. Okay, let's go back to that. So data mining is often used to extract large amounts of hidden data, which you have not been able to use it. So you may have data, you may got some access to the data, but you don't know that it's hidden. How do you take out the concealed data? So that valuable data is important because you're going to use it in large quantities and you're going to take decisions and create a new perspective on the use of health. That's what it is, right? So the definition of data mining, importance of data mining, and the benefits of data mining in the healthcare industry is what we are going to look at it. Is that clear?
Yes, sir.
Yeah.
Yeah.
So in simple terms, data mining is nothing but unexplored data, hidden data, concealed data, which was not there in the previous times, but now that you're going to unravel it or you're going to extract it. And why you're doing it, it will be useful to you for a longer period. So, what are the different approaches that you have in data mining? If you look at it, one and the foremost thing is the prediction. You are going to predict it, and hence you're empowering patients and doctors through that intelligent data. So last time you had the medical history of the patient and you never consider his diabetes or you ignore something. Now that element is also you're going to explore it. This is going to help the doctors as well. So the improved healthcare access is also going to have the efficiency in the diagnosis. So diagnosis can be done with that efficiency. So there are lots of classification of the data mining approaches. There is this thing called the K nearest approach, the K nearest neighbor method. Then you also have decision tree method. There are different data mining approaches. Few of them are listed here. And the support vector machine technique. A neural network is very popular. Bayesian method is using the probability. Regression method, as we all know, in the statistics, to try to regress the uh, independent variable to find out what is there in the dependent variable. Then the clustering technique, and then the association method. So these are the approaches that we have. Let us look at how do we categorize patients based on the health status, and also multi-level, sometimes binary classification. If you have two, then it is the binary classification. If you have more than one or more than two, it is the multi-level. So what is the importance of classification in the healthcare industry? I think it has immense benefit and so on. Let us look at this KNN. KNN is nothing but K nearest neighbor. So K nearest neighbor is the method. So you discover unknown points using the known points. K is known, right? The K stands for known, known part,
Okay.
right? So through the known parts, you are going to find out the unknown. What I did not know, and I will be able to know through that. Okay. So then the real-time usage in the disease and factor relationship. This uh, KNN is you often used for real time. That means then and there itself. It's not just waiting for historical data, but you're waiting to get it done and applied in the real time basis. And application in the heart disease and thyroid diagnosis, this has been quite helpful. What you did not know about the patient in the heart disease cases and also in the thyroid diagnosis, KNN method is quite useful. Then comes the decision tree. So decision, as we all know, everybody has to take a decision. The patients need to take a decision whether they want to go for a surgery or not. The doctors have to also recommend whether they will go for surgery or not. So it is very simple. It's like a family tree. It is like a tree structure. And every tree has a stem and the branch, right? And then the leaves. So if you do this, then it leads to that. Those kind of things. So stem, branches, leaves, fruits, as in tree that you have. So it will have repercussion. All the decision is going to have repercussion. Especially this one is used with the probability. Probability is one of those statistical techniques which is highly recommended. And in this method, you will have the chances. What is the chance of the patient surviving the cancer? Through the decision tree, you can tell if we have chemotherapy, and we will be able to do this in the maybe 40, 30, or maybe 45 sittings. That's what it is. The decision tree is usually used in those, crucial decision about the survival of the patient, and be it in cancer, right? Then comes the SVM. SVM stands for Support Vector Machine in Healthcare. Support Vector Machine. Look at all these methods have statistics in it. The vector. Vector is nothing but the matrix. So you're going to categorize for diabetes individuals, type 1, type 2 diabetes, what stage of diabetes that they have, do they have it before fast, after eating, all those things. So it's a two-dimensional. It's a, let me just write it here. It becomes much simpler. It's a matrix. You will have rows and columns. So rows and columns are nothing but the vectors. Through the vectors, you can easily make out. The row might give you the record of the patient, and the columns might tell you the different categories of it. So record of the patient in the row, and then the columns might uh, indicate the categories that you have. So it's wonderful mechanism like an Excel sheet. All Excel sheets are vectors or matrix in some sense. So it's a two-dimensional plane. You can have it, right? I can open an Excel sheet for you to show you. Let me just quickly go, and how does it look like? Uh, yeah, yes, I think it's here. I'm just opening one of the Excel sheets, opening a blank one. Look at this one. This is the rows and columns, right? These are the, this is a row. One is a row, and A, B, C, D, E, F, G, H are the columns. So one is a record, the patient. Second is a patient, whereas a patient can have here, right? So here could be the name, and you can have the name like Naini or Nainas, and then probably here type 1 diabetes. It could be here type 2, I may have or not, you may have it or not. Okay, something like that. So it's a very wonderful mechanism to look at that. Okay, I'm not saving it. Let me go back to the same thing. Yeah. Okay, so that's the one. Okay, so this is to measure the diabetic ratio of the patient. To the ratio could be how many patients are there for each doctor, or how many
How many
patients.
patients?
Yeah.
Yeah.
Okay.
Okay.
I think you
I
have to
think you
move
have to move
for all
for
diabetes.
all.
Okay, it's slightly better now, because otherwise it was creating problem. All right, so let's move on and look at the other things. Neural network. What do you mean by neural network? Any idea? This is slightly interesting, and this is a very broadly used in healthcare these days because of its benefits like diagnosis and treatment of various diseases. Neural network NN is used, like example chest condition, lung cancer, asthma, in all the areas where one thing is linked to the other. It is never a standalone. You may feel that I have a backache, but that backache is maybe because of the spondylitis, or maybe because of the sciatica that you have, because of the vertebrae column defect that you have. That's one. And moving on, let's look at few more things. This is a Bayesian method. Bayesian method in healthcare is another technique that you have, purely based on the Bayesian probability classification theory. And in this method, what do they do? This kind of data technique is usually done for data mining, especially discovering illnesses factors and their ratio. How many of the patients are falling ill as far as diabetes are concerned? What is the probability of patients falling ill in 2030, if that is the case? And then it can also be used in determining diseases and causes and their relationship. What causes diabetes? Many people feel that it's a sugar. If you consume a lot of sugar, you end up into it. Sugar does not cause diabetes. So what has caused diabetes? Probably it will be able to sustain it. So there is this insulin resistance that can happen because of the uh, intake of the sugar. Then comes the regression. What is regression? Any idea? Have you heard of regression?
Regression. In statistics only we learn about regression.
Yes, yes, you're right. So when you learn about regression, there is one independent variable or many independent variables, and then there is I have to manage because I could hear my own voice. So whenever you feel like releasing the mute button, you can. Otherwise, you can put that in the chat box. So regression in is nothing but the way that the variables are related, and it has a causal effect. Dependent variables and independent variables. Independent variables will actually going to determine their dependent variable. Dependent variable is dependent on the independent variables, isn't it? Like intake of sugar leads to diabetes. So one causes the other. That's the relationship. It's not association. It's not just correlation. It is beyond that. It is regression. Right? Predicting the survival time of the cancer patient through regression, you can always going to you can regress, and you can also going to predict it. All these tools, if you look at it, statistics are they are all divided. Why are we using data mining? Because we also wanted to predict the survival rate of the patient, especially in case of the cancer patients, and also trying to understand the impact of symptoms and the patient health condition. If these are the visible symptoms, are these symptoms going to impact the overall health of the patient? So most of the doctors are dependent on the symptoms. Symptoms will help them to find out the cause of the disease, and then also allow them to diagnose it properly, and then you can have the treatment. That is one of the methods called regression in healthcare. Then we also have data mining applications in healthcare, like enhancing the medical research and healthcare system. More and more research that is happening in the medical sciences is largely because of the data mining techniques or data mining application. So these data mining applications, you may use the fuzzy based neural networks, fuzzy logic. Fuzzy logic is also used in most of them are used in the computer sciences. Fuzzy logic, fuzzy neural network, genetic algorithms, how the algorithms are written, and how do we actually connect that with our genetics, and so on and so forth. Like, where do we use them? What are the applications of data mining in the healthcare management, overall healthcare management, and then the hospital management and administration as well? That's one. Let's look at health prediction using data mining. So you need to have for immediate healthcare guidance when doctors are unavailable. So uh, there are lots of applications where they have created, you know, the doctors' databases, and you need not really personally go and consult it. It can happen online as well. So, how do you get guidance when the doctors are not available, especially in the rural areas, especially places where access to healthcare is a tough thing? And that's why the health prediction system, you may have online consultation and support. We have seen that enormously during the COVID time. So, coronavirus pandemic, you had this consultation, and that's why it is important. And then the intelligent data mining techniques for accurate illness prediction. Accuracy is another important thing. So let me just put that. Uh, the other important thing in data mining is the data mining is also useful in accuracy of the prediction of the diseases. This is quite crucial. Okay, some of the system features like patient login and registration. So you may give patient also access to his or her records. You can have patient details there, disease prediction, search for doctors. You can also take the feedback. Then the doctors can also log in. Then you can have the notification for doctors, and then you can have admin login and management of doctor, diseases, patient, and feedback. Is there anything that is missed in this prediction of data mining? Everything has come almost. If you look at it, is there anything you feel like we can add to the systems features? I don't think so. Okay, so let's move on and look into it. So what are the software and the hardware requirement to run this databases? You need to have software and hardware requirement. Look at the hardware requirement. What kind of things that you will have? First and the foremost thing, the previous version of the Windows would not work. It has to be 7 plus Windows operating system, and you should also have a Microsoft SQL server. Then you should be able to have installed in your system Visual Studios processor. Minimum needs to have the dual core hard disk, no less than 50 GB. In fact, we are all talking about 500 GB or 1 terabyte or 2 terabyte. Memory, you cannot have less than 1 GB. Otherwise, the RAM and your database will be difficult to run. It has its own problems. So, what are the advantages? With this kind of server available, the doctor will have the information about the patients 24 by 7. Anybody who is not even seeing you, but they have the records, they can actually help you. That's what it is. And then the instant diagnosis and guidance, it can give you immediate diagnosis and guidance. It can also increase the online client base for the doctors. Disadvantages, uh, some of the disadvantages could be that system requires doctors for full diagnosis, so they should have access of the full database. If you're giving only one module, two module, it may not be helpful. Let's move on. So there are lots of sectors in which data mining can be helpful and make the best use of for the business efficiency, including in manufacturing, chemical, marketing, aerospace, and also in health, undoubtedly. So it is suitable for all kinds of patients, their family members in emergency and everything, because you have access to the data. If you make a database of the patient, it would be as good as anything like physical patient. In fact, better than the physical records, because you are able to access the records remotely as well. So data mining implementation process is done through cross industry standard process for data mining, that is called CRISP. Okay, let's move on. Some of the sample applications, if you look at it, doctor appointment booking and live chat app. You can have the robot. Let me just do this. I can do this, right? Let me go here, and I'm typing KIMS. Let's see what comes out. KIMS hospital has come. Mhm. Let's see what is there. Does it have a bot? No, it doesn't. It doesn't, right? It is not. Or Yashoda Hospitals. Let's see. Does that have a live chat? It shows this. Okay, so you can even call, you can get appointment, and you can have a chat on WhatsApp also. If you want to just click this, it will be directed to the. Look at this one. It goes to there, right? So you can have that. This is at the basic level, but once you have the login and other information, so you the doctor appointment booking and everything can be easily done. And then you can also check if you have a chat bot, like here is a chat box, no? Look at this one. Mhm. I'll show you where are we. There we are. Yeah, yeah, here. This is like a chatbot. So I will type here, can I get an appointment for tomorrow? So the message from the other side might come, what time? That's how you will be able to get it. See, it becomes two-way, a two-way communication. That is why it is important to look into it. Okay, let's move on. So the importance of early detection of the disease, yeah, the sooner that you go, the better it is. It's always good to know. And then the online doctor application for disease identification, doctor's recommendation, appointment, consultation, everything. So there are lots of advantages of doctor appointment booking online and chat. One is that easy appointment, you can schedule it, it's up to date, the knowledge about the diseases and the symptoms for the patient is quite good, and in app chat for tracking the patient health. But there are few limitations, like the project output affected by wrong input. If you are not really inserting the right information, it gives you the wrong input. If you have not entered the age properly, if you have not entered the disease properly, the previous existing diseases, all that is going to affect you. Single point failure for Android mobile user. Sometimes, because of the updation and other things, it might be problematic as far as the Android application is concerned. And there might be admin's manual addition of the diseases and waiting time for the doctors, because the doctors may be busy, they may not even open the database to give the recommendations or identification or appointment or consultations or detection, all that is there. Okay, what are the other data mining tools? Have you seen any one of them? Did you see or use or you know anything about them? I know SAS, the power to know. Okay, so these are the different data mining tools. How do you do data mining? From the process of unknown patterns to the known patterns. You can do it through Teradata, Board, Dundas, and InetSoft. These are the ones. So data mining is all about, again, trying to find out the patterns and the trends in the databases. And you can also identify the process of the selection and exploration. And data mining is used to extract large amounts of the data. That's what it says. So what are the sensor data in the medical informatics? Let's look at it. So health information is obviously crucial, because you will like to know about the patient's history, patient's outcome, what kind of history the patient has, and what kind of the treatment that he's going to get. So medical informatics combine information science, computer science, healthcare, all of that. So it's a combination of all the three, if you look at it. So it's first and the foremost thing, you're using information science, lots of data. You're also using computer science. Then you are also using healthcare. So overall, to optimize the health information. So patient health information can be viewed individually as well as or part of a large database. And you can also analyze the whole population. How many TB patients are there in Hyderabad? So that's a large population. But what is this TB patient doing in Banjara Hills? That is why there are more people in Banjara Hills are diabetic. Those kind of details you can have. So medical informatics is a multidisciplinary subject. It allows you this computational innovation. It has information science, computer science, and also the healthcare science. So you use machine learning. That means constant improvement, and you can have lots of interoperability. So you can operate from various platforms, various places, various geographical regions, and so on. So what is the importance of digitizing medical data? One is that you will be able to uh, store them, and also you will be able to retrieve them. And we also have a lot of this medical devices have come. We call it as variable devices, right? Variable. So variables are the ones you have. Okay. So what are the typical medical databases or data types? So the first one is the sensitive data. The other one is non-sensitive data, and the last, both of them, if you look at it. Yeah, let's look at the
Sir, I
sense.
have a query.
Hello, you want to say something, or do you? I don't see.
सोचा मैं सर मैंने
Okay, let's quickly finish it off. Sensitive data. What is sensitive data? Contains patient information or can be linked back to the patient. So it's always very sensitive data, which is crucial, which cannot be sold out. It has to be, highly secretive, sensitive. It can have repercussion. Whereas non-sensitive data, I mean, the data without patient identification, general thing, like the population data. So who is the patient there? You may not get it. The macro data sometimes. So storing medical data in the databases, you have to segregate it. You have to have two compartments: sensitive and non-sensitive information. Medical sensors, you will able to overview all the medical sensors. You have to able to apply compliance with the safety standard. You have to have statutory specifications, precise measurement. When you say zero point 0.1 or 0.001, you have to be that precise. You need to have stability, constancy, and the response time has to be quick. Anything can happen. And then we live in this, not the analogous life, but digital outputs. So there are various sensors like vision, imaging sensors, temperature sensors, radiation sensors. In the hospital you have them, isn't it? How do you maintain the temperature of the patient? How do you respond to the external environment, through imaging, through vision, all those things. So what are the functions of the medical sensors? Look at them. uh, Different explanation of the different sensors. You have ECG, you have glucometers, magnetometers, you have airflows, various ways, right? So the sensor data are going to be used for continuous and Markovian behavior. These are the different techniques that you have in each of the managing sensor data. So sensor informatics and data fusion, that means mixing of things. We'll have medical technology, biosensor, smartphone. Everything now can also be attached to your smartphone. What is happening in the hospital, you can even check if you are the proprietor, if you are a doctor, if you are a head nurse, you can do that. And there is this hospital called AIG, which is using robotics in their surgeries now, and a lot of autonomous systems and healthcare systems are there in the sample data. So what are the non-clinical healthcare data applications? Let us quickly look at them. One is the, when we say non-clinical, that means patient reported outcomes, PRO, with no interpretation from the clinicians. So when patient reported outcomes collection is aligned with clinical care, this might also be used in the real time triage patient, and especially for quality and monitoring purposes. So this uses would be transparent to patients, clinicians, doctors, researchers, hospital administrations, and all the other stakeholders. So what are the non-clinical factors and determinants? Social, behavioral, environmental factors. These are the ones that are there to help in the delivery and the policy of it. What are the social determinants if you look at it? Overall, the social determinants of health in India, like importance of social determinants. So there are guiding principles for ethical purposes, uh, like clinical, non-clinical usage. How do we use the data tools? Identifying community resources. Do we have it? Don't be able to get it. Involving patients, caregivers. Caregivers is another important social determinant. So there are a few challenges for the non-clinical determinants. One is the attribution, data sets, analysis tools, all of that. So there are also micro data sets and then the improved analytical methods. So non-clinical data have an impact of the analytics. The non-clinical data is crucial and it will have also have impact on the healthcare analytics. Like it is based on the risk accountability. So driving comprehensive data analysis. And what are the sources for non-clinical data? One is a patient reported thing. So you get direct reports from patients, and you can also use the real-time one. And then the environmental sensors, especially the exposures onto it, and how do we uh, integrate in more meaningful way those things. So the last one is the healthcare cost prediction, and we will wrap up with that quickly. So let's look at it. So approximately 3.9 CAGR between 20 and 24, that is 4 years, it's going to reach to 10 trillions. So global healthcare spending is going quite high. It's really running into trillions. That means uh, the economy of India and China put together. India is now right now is 3 trillion economy. So rising healthcare costs are the major public concern all over the world. Now, can we reduce that and also predict and prevent the diseases? That's what it is, isn't it? That's the whole idea behind it. So, how do we do that? So, we have to be clear on the spending driven by the population. What about the ambulatory care and outpatient cost? And then some of the other diseases like diabetes, lower back, neck pain, high blood pressure, other conditions attributed to also the cost. So look at where is the cost going up. What are the different methods for cost prediction? We again come back to the help of the uh, statistics. One of the method is a regression analysis to estimate the relationship between dependent and the independent variable. So multilinear regression is the way to predict the cost. So like age, BMI, body mass index, smoker status can be used as independent variables to, if your age is high, if your body mass index is low, and if you have a smoker status, then probably your healthcare would go up. What are the other things? Trees and clustering can also be similar in that direction, and both will help in finding out the risk factor as well as the prediction of the healthcare. What about the performance measure? Performance measure is can be done through ratio, penalty error, absolute prediction. So these are the APAs that will help you to forecast and realize the cost. Cost of illness will help you to prioritize policies, allocate resources, and understand the measuring the cost in the cost of illness. Cost of illness is nothing but the impact of disease on the health outcomes and the finances. I mean, if you fall sick, what are the outcomes on the finances. So, what are the challenges as far as the healthcare costing in India is concerned? It's quite challenging because the healthcare due is limited public funding. We spend less than 2% of GDP, which has a huge population. We are more than 1.5 billion now, and we have few schemes like Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana, we which is also a highly public funded scheme. India also has a private healthcare, and we also need to have the accuracy and the detailed information as far as the economic cost is concerned for such schemes. So we can also get it through the help of healthcare technology assessment for allocating the right sources or distribution. The limited availability of the cost data is a major concern. Insufficient cost data is also leads to different or difficult decisions, sometimes inaccuracy in the assessment, and it will not going to help you to understand the burden that the patients will have as far as the cost is concerned. So good quality cost information is very crucial. That's the difference between price and the cost. A price will have profit, cost will have only the expenditure that you got. So a lot of healthcare systems like UK, France, Australia, they have a good cost data, whereas India has a broken health system, and which is why it becomes challenging for the regulation and variation of the prices. Same hospital might charge differently to different people. That's the problem. So what are the other challenges? One is to initiate and improve the healthcare costing. The other one is to have national health system, and then the data should be collected so that you can have the reimbursement rates and so on. So some of the benefits of the cost predictions: accurate predicting future cost depends on the factors, and the data driven predictive models can also help deliver care, reduce the wait time, decrease the readmission, and it's going to be quite helpful in understanding the patient data and provide the timely treatment, accurate treatment, and also improve the health and the outcomes of the patient. So this is what I have for you. uh, we are done with module